Hi, my name is Asad. I'm a neurologist. I treat neurological conditions, but I focus on traumatic brain injuries. Today we're going to talk about concussions. So many different reasons to have concussion. The four probably more common categories that we see sports-related concussion, so either high school, college, or adults who participate in sports where you have an increased tendency to have head trauma. So that would be things like football and soccer and lacrosse, etc. Certainly, if someone is involved in wrestling or boxing, mixed martial arts, those are higher risk sports. Motor vehicle accidents constitute a large group where you can have traumatic brain injury. Interestingly, you don't actually have to hit your head against anything. If you're going at 50 miles an hour and come to a sudden stop, the brain is also going at 50 miles an hour, and when it comes to a sudden stop, it hits the inside of the skull, and that can cause traumatic brain injury. So that's a frequently underdiagnosed, underidentified cause of traumatic brain injuries that we see a lot. Someone who's been in the military and has been exposed to explosions, etc., that's another big category that we see. And then, unfortunately, there's also domestic abuse, assaults, and these are things people don't like to talk about. So if people are presenting with symptoms of traumatic brain injury, sometimes you have to dig a little deeper and try to find out what the cause may have been. And sometimes we do find that people are victims of domestic abuse. One other category that seems to be missed a lot is elderly people with walking problems, gait issues, who tend to fall and hit their head and sometimes don't tell anybody about it. So that's another group that we tend to see. So symptoms of TBI include headaches, dizziness. Now, dizziness is mainly disequilibrium, as in unsteadiness on their feet. But sometimes if you hit or move the crystals in your inner ear, you can also get positional vertigo. So we do tend to see that as well. You can have cognitive issues. So those are the three main ones. But then we can see depression, we can see insomnia, we can see emotional lability or labile moods. So many different and seemingly unrelated symptoms. So important to put that all together and see if there's a temporal relationship to head trauma and onset of all these symptoms, particularly if the person wasn't suffering with these symptoms before the head trauma. So the good news regarding mild traumatic brain injuries or concussions is that in 95% of people, they will get better on their own. Like within 3 to 4 weeks, all the symptoms will resolve with or without treatment. It's important to identify this because if you don't identify it, and particularly if you keep stressing the brain when the brain is stressed, you could potentially end up with more protracted symptoms, sometimes lasting months, sometimes even years. So the best treatment for concussions is rest. That is rest from physical activities such as the sport potentially that caused the concussion, or even scholastic activities like if someone is in school, you want to make accommodations, and then sensible return to activities as the symptoms improve. There are various supplements and even some prescription medications, although we don't necessarily always use those because a lot of times, just identifying the symptoms, resting, rehabilitation might be enough in treating people who are concussed. The reason we try to identify these symptoms is because we can help them symptomatically with some of these, with the headaches, with the mood issues, with the emotional lability. And I always tell people, I'm not a huge medication pusher. I wouldn't take a bunch of medications myself if I didn't have to. However, in this situation, sometimes some of these medications are helpful in nipping the problem in the bud, and then as the symptoms improve, we get rid of the medicine. So it's almost like you break a leg, you use a crutch. When your leg heals, you get rid of the crutch. And so, in terms of what we can do for these emotional issues, depression, like I said, we can use some supplements, certain medications, and then watch them as they improve. In terms of lifestyle adjustments, if it's a more serious or protracted condition where the symptoms are going on for months or years, in addition to medications, sometimes rehabilitating the brain also helps. And there is a psychological and social part to this, and we try to address all that. So, sometimes we have to work with the therapists in that regard, and sometimes psychologists as well. Again, my name is Dr. Asad, and thank you for watching.